Hello, you're watching Eye on Africa. I'm James Creedon. These are our headlines this evening. The World Health Organization is warning that new cases of COVID-19 have been rising since the beginning of May across Africa, and a resurgence of the pandemic could surpass previous waves. By next week, we'll have details on that at the top of the show. Coastal cities such as Cape Town are in need of urgent action to fend off the effects of climate change, so says a UN climate report seen by AFP. It warns that swelling oceans could significantly alter the contours of our continents and their coastlines. More on that coming up. And dozens of incidents of assault on homosexuals have been registered in Senegal in recent weeks. Many gay men and women are fearing for their safety in a climate of increased homophobia. We'll bring you a report on that later on in the show. Thank you for watching. Now we start with the WHO sounding the alarm about a third wave of COVID-19 in Africa. In most countries on the continent, there has been a slow uptake for vaccination, yet the threat is greater than ever, according to the UN health body. It points out that the Delta variant that so badly affected India has now been detected in 14 African countries, including Congo, Mozambique, Namibia and Uganda. Let's take a listen now to Dr. Matshidiso Moeti, Regional Director of the WHO for Africa.
The third wave is picking up speed, spreading faster, hitting harder. We've surged past last year's peak, and at the current pace, continental cases will surpass the second wave's peak in just about 3 weeks. This is incredibly worrying. With rapidly rising case numbers and increasing reports of serious illness, the latest surge threatens to be Africa's worst yet.
I'm encouraging all countries in Southern African region to pivot their message to that. You don't just wear masks in public, but indoors you should still be extremely careful. A lot of transmission occurs in households. Let me put it very bluntly. We are not winning in Africa. We are not winning in Africa, this battle against the virus. So it really doesn't matter to me at this point whether the vaccines are from COVAX or from anything. What we need is rapid access to vaccines to member states.
And that was John Nkengasong, Director of the Africa Centres for Disease Control and Prevention, also warning of the need to remain vigilant with the risk of a third wave of COVID-19 across the continent. Now, Tunisia is a case in point. Authorities there have ordered 4 regions to go into lockdown following a spike in fatalities related to the pandemic. Kairouan, in the centre of the country, is one such region. Lila Blaise and Hamdi Talili travelled there for France 24. Let's take a look.
At the emergency room in Ibn Jazar Hospital in downtown Kairouan, COVID-19 patients with their oxygen cylinders sometimes on the floor wait to be transferred. Those dead from the virus lie behind screens.
On est dépassé. Pratiquement, c'est une urgence. Donc, on doit recevoir toutes les maladies. On reçoit presque 100% de Covid. On n'a plus de place. Les malades Covid et les malades non Covid, presque, ils consultent dans la même salle.
This man brought his mother to hospital himself after failing to find an ambulance.
بالرسمي الدولة وين يا أخي الطبيب شنية مش يعمل وحده الطبيب وحده يجري من بلاصة لبلاصة وهذه معناتها الurgence الكل تتصب لهنا والكل تحب.
Authorities decreed a total lockdown for a week.
On a un taux de positivité entre 45 et 50% des bilans. Il faut rester à la maison pour rompre ce cercle de contagion.
Another problem, the registration rate for vaccinations is only at 10%.
Il y a beaucoup de régions rurales, il y a des gens qui n'ont pas l'accès à l'Internet et c'est pour ça que notre ministère a mis en place des équipes mobiles, des campagnes mobiles.
These mobile teams will do same-day registration and vaccinations in these areas. But the lack of personnel is still the biggest problem, like in this makeshift hospital. Since there aren't enough nurses, Milad Nasri and her sister feed their mother who is on oxygen supply. The army has set up another emergency hospital outside with intensive care beds. But the health crisis is getting worse in the country. 3 other regions are in the same situation as Kairouan.
Agence France-Presse news agency has seen an unpublished draft report of the UN's International Panel on Climate Change. That report was not due for release until February 2022. it steps up its warnings on climate tipping points. Coastal cities like Cape Town in South Africa are particularly at risk in the coming years, according to the research. Now, with more on that, here's Nicolas Germain.
For thousands of years, domination of the seas has allowed coastal cities to become trading powerhouses. But now they are increasingly at risk. In a new draft report, UN experts say that climate change is making sea levels rise and endangering millions. In Cape Town, some rich districts have already implemented some measures. Here, eco-sandbags are preventing erosion.
The beach offers huge amounts of social value to Cape Town. The coastline contributes approximately 10% to Cape Town's annual GDP. So it's a significant contributor to Cape Town's economy. And it's for that reason that we need to look after it as far as possible.
But in poorer areas of Cape Town, experts say 100,000 households are exposed to flooding. Some townships are regularly flooded with sewage water.
These kids you see around here, they play in this water. This water is filled with feces, human feces. And this is a daily occurrence. The slightest of rains you find overwhelms the drainage system.
Possible solutions to limit floods are dikes and seawalls, but they can also damage the environment. Rehabilitating coastal ecosystems is another option. A buffer of mangroves or marshes can help coastal cities, especially against storms.
To Ethiopia next, where the number of civilians killed in a military airstrike in the Tigray region has risen to 64, with over 20 more unaccounted for, according to local health officials. Now, medical workers and aid agencies are reportedly scrambling to evacuate dozens of seriously injured patients from the town of Togoga to the regional capital Mekele, around 25 kilometres away. The attack, which took place on Tuesday, was one of the deadliest reported incidents in months in Tigray, where the government had said that major fighting ended last year. Now, a military spokesman said rebel fighters were the target of that attack. Now, at least 10 soldiers died on Thursday in a helicopter crash near the Kenyan capital, Nairobi. 13 more were injured and subsequently airlifted to Nairobi's military hospital. The soldiers aboard that helicopter were on a training mission, officials said. Now, incidents of homophobic attacks are stacking up in Senegal. Some 30 cases have been logged by associations in the past few weeks. Viral videos that captured some attacks have been circulating online, further highlighting the problem. Now, all of this follows a demonstration on the 23rd of May last calling for tougher measures to repress homosexuality. Now, Sarah Sacco and Emmanuel Londet have this report.
27-year-old Samba, which isn't his real name, is gay. He lives in Senegal, and over the last few weeks, he's had to be more careful and guarded than usual.
On vit comme des criminels à recherche. On traite mieux les animaux que nous. Quand les jeunes vous voient, on vous frappe, voire même tuer. C'est pourquoi on a peur maintenant, tout le monde. Là où je vivais, on m'a soupçonné. Je ne pouvais plus continuer de vivre là-bas.
Homosexuality is a deeply sensitive subject in the West African country, and gay people are overwhelmingly rejected by much of Senegalese society. At the end of May, a group of Muslim associations protested in Dakar, demanding the criminalisation of homosexuality with penalties of up to 10 years in prison. According to several accounts, since then, homophobic attacks have increased. Human rights campaigners are worried.
La Constitution du Sénégal protège le droit à la vie, protège le droit à l'intégrité physique des personnes. Et cette constitution-là ne fait pas de discrimination entre les citoyens par rapport à la protection accordée. Donc l'État doit veiller à ce que ces actions de violence puissent cesser.
The penal code currently punishes what is determined as unnatural acts with an individual of the same sex with up to 5 years in prison. And the government says decriminalisation is not at all on the cards.
Au Sénégal, nous avons nos valeurs culturelles, nos valeurs sociales, nos croyances culturelles. Et c'est sur cette base que nous nous sommes donné des lois que nous sommes tous tenus de respecter. Et ces lois rejettent toute forme d'actes contre nature.
Homosexuality remains taboo in most of Africa, and in some countries, a conviction for being gay can even lead to a death sentence.
That's all for this edition of Eye on Africa. Thank you for watching. Do stay tuned.
Je regarde France 24 parce qu'en tant qu'étudiante en sciences politiques, ça me permet de rester à jour sur les informations dans le monde, sur les conflits, les débats politiques, tout ça.
الاختلاف بين فرانس 24 والقنوات التانية في المحتوى المتنوع وفي التوجه الأقرب للحيادية.
I like their coverage, especially with the news and the politics. But also I like the cultural aspect because that, me as a Kenyan, I get to learn a lot about Francophone, Africa, Francophone in general, whether it's in Europe or here, just from France 24.
France 24 m'aide à voir une perspective plus complète du monde et à comprendre différentes langues et différentes cultures.
France 24, with you everywhere, all the time. Liberté, égalité, actualité.